I started the Substack at the ChrisCuomoProject.substack.com because we need communities on long COVID where people can trade information about symptoms and what they're doing and if anything is working. Nearly 20 million Americans may have this. And I say may because we don't know. We do know it's a massive problem. Clinicians all over the country, people are studying it in different institutes, government and non-governmental. 4 million Americans have reportedly stopped working because of long COVID. The disease can manifest itself in lots of weird ways. It's ever expanding. Brain fog, joints, processing, lungs, high-end lung capacity, static lung capacity. Here's what a scientist told a Senate hearing yesterday.
It affects the brain, it affects the heart, it affects the endocrine system, it affects the immune system, it affects the GI system. The burden of long COVID, when you measure it, is on par with the burden of cancer and heart disease. Now, you should be asking me also, how do we treat long COVID? You've heard it before. There are zero approved medication for the treatment of long COVID. So these people have nothing to really lean on for curative treatment. Nothing, zero.
That's Dr. Ziyad Al-Aly, director of the Clinical Epidemiology Disease Center at Washington University in St. Louis. And he is one of the emerging sources on long COVID. I'm not even going to call him an expert because he would blanch at that because they're still trying to figure it out. Doc, thank you so much for making time and for bearing witness at the hearing. I wish they had better questions for you, but clearly they didn't know what you were talking about.
Well, thank you for having me. I'm actually delighted that we had the hearing. Delighted that Congress and the Senate is really interested in understanding long COVID and interested in thinking about ways of solving long COVID. And I think I do hope that the testimony yesterday, our testimony, and the whole hearing will initiate a national conversation on how we as a nation need to come together and develop a plan to really solve the puzzle of long COVID. It's a complex problem that requires quite a lot of work, but I think we need to initiate that conversation, and that conversation needs to be in the national space on how do we solve this problem? How do we come together as U.S. people, government, and scientists, and everyone else to solve the problem?
What do you think is missing?
I think there is quite a bit of pandemic fatigue. I think everybody sort of is itching to leave the pandemic behind, and in that drive to move forward and leave the pandemic behind us, we're sort of forgetting that pandemics disable people, that pandemics have after effects, and then we cannot really move on without also dealing with the pandemic after effects. And that after effect, right, Chris, that after that is long COVID. So we right, don't really deal with an earthquake. We don't go through an earthquake without dealing with the aftermath of an earthquake. We can't go through a pandemic without dealing with the aftermath of the pandemic. That aftermath, that sort of the legacy of the lasting legacy of the pandemic is long COVID, and we must deal with it. We cannot bury our heads in the sand and sort of ignore reality. I do understand the itch to move forward. I do understand the itch to put the pandemic right behind us and move forward and forget all about it. But the reality is that our millions of Americans.
Pick up your microphone. He's a good doctor.
Millions of Americans with long COVID. Millions of Americans with long COVID that are suffering from long COVID.
So, Doc, let's talk about that. Let's talk about it, because that's one of the problems. It's not like after chicken pox where you're like, oh, you see this scar here? You see this is from my chicken pox. This is the after effect. Some people don't believe this. Some people think it's hypochondria. Some people think it's malingering. Some people think it's unrelated. We're nowhere with correlation versus causation versus exacerbation, something that's just making it worse. And I was one of the lucky ones because I had all these clinicians all over me when I was sick before the vaccine. Half the people I talked to say it was the vaccine. The vaccine makes you sick. It's the vaccine that gave you long COVID. That's the problem. I was diagnosed with this before I took the vaccine. So what are you seeing? How much of it are you seeing? And how severe is it?
So long COVID is really heterogeneous. If you've seen one patient with long COVID, you've seen one patient with long COVID. There are people who have really mild illness, sort of really very subtle brain fog and fatigue. And we have people all, and at the end of the spectrum, we have people with severe debilitating fatigue, post-exertional malaise, brain fog that is so disabling they cannot literally get out of bed, they cannot work, it really changed their life dramatically. So it is a spectrum of illness.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.